If you're over 60, there's a personal habit that could be quietly eroding your physical and emotional well-being in ways you might not even notice. Masturbation, often seen as a natural and harmless part of life, can pose risks as you age not, because of the act itself, but because of how your aging body responds to it. Practices that felt effortless in your 30s or 40s may now stress your prostate, weaken your sexual function, drain your energy, and even impact your mental health without obvious warning signs. I'm Dr. James Carter, a urologist and men's health specialist with over 25 years of experience helping men maintain vitality, overcome sexual dysfunction, and live with confidence well into their later years. I've worked with countless patients who were unaware that their private habits were causing gradual but serious harm until symptoms became impossible to ignore. In this in-depth guide, I'll uncover the 4 most critical masturbation mistakes men over 60 make and provide practical, actionable steps to protect your health and preserve your vitality. The 4th mistake is particularly insidious, as it's rarely discussed even by medical professionals. If you're serious about staying vibrant, energetic, and connected after 60, subscribe and hit the bell to ensure you receive more tailored advice designed specifically for men like you. If this resonates with you, type 1 in the comments to let me know. If not, type 0 and share how I can better support your journey to optimal health. Let's dive into the first mistake, one that countless older men make without realizing its long-term consequences. Mistake 1. Forcing release without proper arousal. One of the most common issues I see in my practice is men attempting to replicate the sexual habits of their younger years, even when their bodies clearly signal a need for a gentler approach. After 60, your body undergoes significant changes. Blood flow to the penis decreases, nerve sensitivity shifts, and hormonal fluctuations, such as declining testosterone levels, make the sexual response process slower and more delicate. Despite these changes, many men continue to masturbate with the same intensity they used in their 30s or 40s, tight grips, rapid motions, or forcing a climax, even when arousal isn't fully present. I've had patients, often visibly frustrated or even ashamed, confide, "It used to happen so easily, but now I have to push harder just to feel anything." This approach, while it may seem like a harmless workaround, can cause significant damage over time. Forcing an erection or rushing to orgasm can lead to micro-tears in penile tissue, irritation of the urethra, and excessive strain on the pelvic floor muscles. These habits can contribute to chronic groin discomfort, reduced sensitivity, or prostate inflammation, which may manifest as persistent pelvic pain, difficulty maintaining erections, or urinary issues like frequent nighttime trips to the bathroom. The damage is insidious. It builds slowly, often going unnoticed until symptoms disrupt your quality of life. How to avoid it? Shift your mindset from performance, driven to mindful and present. Embrace slower, more intentional stimulation to allow arousal to build naturally, without pressure or urgency. Use a high-quality lubricant to minimize friction and protect delicate tissues, reducing the risk of irritation or injury. Pay close attention to your body's signals. If an erection isn't fully present, don't force it. Instead, explore gentle touch, focusing on sensation rather than rushing to climax. Incorporate relaxation techniques, such as deep breathing or progressive muscle relaxation, to enhance arousal without strain. Consider setting aside more time for self-pleasure, allowing your body to guide the pace. By treating your body with care and respect, you can maintain sexual health, preserve sensitivity, and prevent long-term harm. Mistake 2. Over-reliance on pornography as the sole stimulus. I'll never forget the look on a 65-year-old patient's face when he admitted, with a mix of confusion and shame, "I can't seem to get aroused anymore unless I'm watching something online, and even then, it doesn't feel as good as it used to." This is a common issue, and it points to a deeper problem: relying exclusively on pornography for sexual stimulation. After 60, your brain's reward system becomes more vulnerable to overstimulation. High-intensity, high-speed online content floods your brain with dopamine in ways that real-life intimacy, whether with a partner or through self-touch, simply cannot replicate. This overstimulation creates a desensitization effect. Your nervous system adapts to the artificial intensity of pornography, making natural arousal from physical touch, imagination, or emotional connection feel dull or insufficient. This can lead to a cycle of seeking more extreme content, longer sessions, or more frequent use, which further dulls your ability to enjoy real-world intimacy. The impact isn't just physical, it's deeply emotional. Many men report feeling isolated, disconnected from their partners, or even depressed without understanding why. Some describe a sense of emotional numbness or a loss of desire for genuine closeness, unaware that their pornography habits are rewiring their brain's reward system. This isn't about judgment or morality. It's about biology and the brain's remarkable but vulnerable adaptability. How to avoid it? Start by gradually reducing your reliance on pornography. Begin with small steps, such as incorporating alternative forms of stimulation, like recalling personal memories, engaging your imagination, or reading erotic literature to reawaken your brain's natural arousal pathways. If you're in a relationship, prioritize physical and emotional intimacy with your partner's simple acts, like holding hands, sharing a quiet moment, or engaging in non-sexual touch can rebuild connection. Set achievable goals, such as 1 or 2 screen-free sessions per week, and track how your sensitivity to real-world stimuli improves over time. Consider mindfulness practices like meditation or journaling to reconnect with your inner world and rediscover what truly sparks your desire. Your brain remains adaptable, even in your 60s, and with consistent effort, you can restore your capacity for genuine pleasure, emotional closeness, and lasting satisfaction. Mistake 3. Masturbating too frequently for your body's energy levels. A 71-year-old patient once sat in my office, visibly weary, and asked, "Could I be overdoing it?" He was in decent health, but struggled with constant fatigue, irritability, and a lack of motivation for activities he once loved, like gardening, biking, or socializing with friends. After some discussion, he admitted to masturbating daily, sometimes multiple times, believing it was a harmless way to relax or unwind. In reality, it was quietly draining his energy reserves and disrupting his overall well-being. The notion that frequent ejaculation is always healthy or beneficial doesn't hold true after 60. Your body's recovery processes slow down. Hormones like testosterone take longer to replenish. Your nervous system needs more time to reset, and your energy becomes a more precious and finite resource. Excessive masturbation, particularly when driven by stress, boredom, or habit, can deplete your system rather than rejuvenate it. The effects are subtle at first. You might wake up feeling groggy, notice a dip in your drive, or experience mood swings that seem out of character. Over weeks or months, these can escalate into disrupted sleep cycles, temporary testosterone dips, or even prostate strain, which may contribute to symptoms like urinary urgency, frequent nighttime awakenings, or a general sense of low vitality. Many men attribute these changes to just getting older, not realizing that their private habits are a significant factor. How to avoid it? Align your sexual habits with your body's current capacity. For many men, reducing frequency to once or twice a week can restore energy, mental clarity, and emotional balance. Others may benefit from exploring non-ejaculatory stimulation, which allows for connection and pleasure without taxing the body's resources. Pay close attention to how you feel in the hours or days after masturbation. Do you feel energized and refreshed, or drained and foggy? Use this as a guide to find your optimal rhythm. Incorporate alternative stress relief methods such as meditation, yoga, light exercise, or creative hobbies like painting or writing to reduce reliance on masturbation as a coping mechanism. Consider keeping a simple journal to track your energy levels and mood, helping you identify patterns and adjust accordingly. By treating your energy as a valuable resource, you'll feel more vibrant, engaged, and present in all areas of your life. Mistake 4. Ignoring prostate health during self-pleasure. The prostate, a small but critical gland, becomes increasingly sensitive and vulnerable after 60, yet many men unknowingly stress it during masturbation. I recall a 68-year-old patient who came to me with a persistent sense of pressure after climax, coupled with a feeling of incomplete bladder relief. He was active and relatively healthy, but couldn't pinpoint the cause of his discomfort. After exploring his habits, we discovered he was masturbating in ways that irritated his prostate, sitting in a slouched position, applying pressure to the perineum, or neglecting to urinate after climax. These seemingly minor habits can cause inflammation, leading to chronic prostatitis, urinary issues, or ongoing pelvic discomfort that affects daily life. The prostate plays a vital role in male health, influencing bladder control, urinary function, and overall comfort. Habits like masturbating in a slouched or compressive position, using excessive force, or skipping post-climax urination create a perfect storm for irritation, which can build into more serious issues over time. Symptoms might include weak urine flow, frequent nighttime bathroom trips, a burning sensation during urination, or a lingering heaviness in the pelvic area. Many men dismiss these as inevitable signs of aging, but they're often preventable with small, mindful adjustments. Protecting your prostate isn't just about preventing disease, it's about preserving comfort, confidence, and control in your daily life. How to avoid it? Adopt simple, mindful habits to protect your prostate. Always urinate after climax to flush the urethra and reduce the risk of irritation or infection. Avoid positions that compress the pelvic area, such as slouching or sitting on hard surface soft for lying down comfortably, or sitting upright with proper support. Be gentle during stimulation to minimize strain. Christensen, the pelvic floor and prostate. Incorporate pelvic floor exercises like Kegels to strengthen the region and support long-term prostate health. These exercises involve contracting and relaxing the muscles used to stop urine flow, and practicing them for 5-10 minutes daily can make a significant difference. Schedule regular checkups with a urologist to monitor your prostate's condition, especially if you notice symptoms like urinary changes or pelvic discomfort. By prioritizing these changes, you'll maintain ease, confidence, and control in your daily life. Conclusion: reclaiming vitality with wisdom and intention. You are not broken, and you are not alone. The changes you may be experiencing, lower arousal, lower energy, subtle discomfort, or a sense of emotional disconnection, are not signs of weakness, but signals from your body asking for a new approach. The 4 mistakes we've explored: forcing release without proper arousal, over-relying on pornography, masturbating too frequently, and neglecting prostate health, are subtle but powerful. They creep in quietly, eroding your vitality, confidence, and connection until you wonder where your energy, desire, or sense of self went. The good news is that you have the power to change this trajectory, and it starts with listening to your body. Slow down your approach, using gentler, more mindful techniques that honor your body's current rhythm. Reduce screen time and reconnect with natural arousal through imagination, memory, or real-world intimacy. Moderate your frequency to align with your energy levels and prioritize prostate health with simple habits like post-climax urination, proper posture, and pelvic floor exercises. These adjustments aren't about restriction. They're about reclaiming a vibrant, fulfilling life rooted in self-respect and wisdom. Your sexual health matters not just for pleasure, but for your energy, relationships, and overall sense of well-being. This isn't about forcing your body to perform like it did decades ago. It's about embracing a new chapter defined by sensitivity, curiosity, and care. I've seen men in their 60s, 70s, and even 80s rediscover their vitality by adapting to their body's evolving needs. They feel more alive, more connected, and more confident than they thought possible, not by pushing harder, but by listening deeper. Take one small step today, perhaps a screen-free session, a gentler approach, a new posture, or simply asking, "What does my body need right now?" instead of, "How fast can I finish?" These changes ripple beyond the bedroom, enhancing your quality of life, sense of purpose, and emotional connection. Don't judge yourself for past habits. Thank your body for speaking up and commit to treating it with the care it deserves. Consider keeping a journal to reflect on your progress, noting how small changes impact your energy, mood, and confidence over time. In my next video, we'll dive into practical, natural strategies to boost erections, support prostate health, and reignite energy after 60 no pills, gimmicks, or shame required. We'll explore techniques like dietary adjustments, targeted exercises, and stress management to enhance your vitality holistically. If this guide resonated with you, like and share it to help other men take charge of their health. Every share could be the start of someone's transformation. Let's redefine what it means to thrive after 60 together, with wisdom, intention, and strength that comes from understanding.